Okay, welcome everybody. Um, I don't know if I should give a couple of minutes for people to join or should I just start?
Yeah, no, I think we can welcome people into the space. People are starting to come in. Welcome. Thank you so much for being here with us today. I guess I could let everyone know that we do have closed captioning available. If you would like the closed captioning option, you can press, well, my screen looks a little different now, but on the more button, there is a captions button, and that will bring the closed captions up for you. Also, after today, this presentation will be available as a recording that will be on our YouTube page and our website. So thank you. And I'm going to hand it over to the beautiful Porchia Dees.
All right, welcome everybody. Thank you guys for joining and sharing space with us on this beautiful Monday morning. I'm gonna share my screen. Let me know when you all can see it, okay? Um, can you guys see my screen?
We
Yes.
sure can.
Okay, so thank you guys for joining us for this presentation of lifetime survivors of HIV from childhood, sorry, from childhood to adolescence and beyond. And then let me go to the next slide. Oh, sorry, guys. Alrighty, so my name is Porchia Dees. I use she, her pronouns, and um, we're gonna share something like we're gonna share things about ourselves that's not related to like HIV, our HIV work. So I am a caregiver for my father. And I'm like super family oriented. I wouldn't be the person I am today without my family. So, and then also I'm a student, a graduate student at Azusa Pacific University, and I'm going to school to get my master's in social work. I want to welcome all of you guys to also introduce yourselves in the chat, you know, say your pronouns and where you're at in the States. Let us know where you're at. So that's me. And now I want to introduce you guys to our panelists. Um, actually,
Hello.
yes, I'll let them introduce themselves. And just share your pronouns, where you are, and anything about you that's not HIV related.
Hi, my name is Alex. I live in Riverside, California, and I've been HIV positive for 42 years, given a blood transfusion at birth. And what I'm into is kind of education. I'm a teacher. In addition to, I do martial arts, Brazilian Jiu-Jitsu, and I'm kind of um, I I'm here for a purpose, and that is to make sure that my story and our story isn't forgotten in our society.
I guess I'll go next. My name is Lynnea, she, her. I live in West Hollywood, California. I'm a mom, I'm a dog mom, something not related to HIV. If you guys use TurboTax and use the live help, I'm most likely one of the people who will be helping you file your tax return. I've been doing taxes for the last 8 years and I hate it, but I love it. Yeah, I'm a tax geek.
Name's Talissa. I'm here in Florida. I'm a she, her pronouns. I'm a registered nurse. And I recently just got accepted to go to school to continue my education onto becoming a nurse practitioner.
Okay, thank you guys for sharing. So I'll be facilitating, but really like the heart of the conversation is going to come from our panelists. So thank you guys for introducing yourselves. Next, I will go over our community promises. So The first one is just be respectful of each other's viewpoints and experiences. Um, be open to learning. And then last but not least, the confidentiality agreement, the Vegas rule, what happens here stays here.
Mhm.
We'll be sharing some personal experiences and so, you know, we just want this to be a safe space. All right. So our agenda is we'll be going over who are lifetime survivors. So, you know, the who we are, our experiences. We'll be going over the health considerations of aging with HIV since birth or early childhood, mental health for lifetime survivors, sex and love. Oops, sorry. Staying healthy and staying connected. And we're gonna make time also at the end of this presentation for Q&A. So I can't see the chat or I can't see any because I'm sharing my screen. So if you guys can hold your questions until the end, we're gonna make space for that. Okay, so our training was developed for us and by us. We developed this training in our support group meetings, and we're sponsored by an organization called NMAC. So they kind of helped us to also like, you know, put it all together. Um, and we're adults with careers and families striving for more visibility and advocacy. And I feel like we've been left out or overlooked in these HIV and aging discussions. So I'm very grateful for the Reunion Project for allowing us to do this webinar so that we can tell our stories. All right. So who are lifetime survivors? Um, so I think I kind of want to go over the difference between a lifetime survivor and a long-term survivor. Um, the actual definition of a lifetime survivor is someone who contracted HIV between the ages of from birth to 5 years old. And um, so it can be one or two ways through perinatal transmission or through blood transfusion. And so I think the key differences between what a lifetime survivor is and a long-term survivor is that we don't know a life before HIV. So we like don't have no pre-diagnosis identity to refer to because HIV is our normality and we've been living with it for our entire lives. Throughout our developmental stages. So, you know, while our immune systems and our brains and our bodies, while we were still physically and cognitively developing. And so perinatal, I'll just read over the definition of perinatal transmission. It's someone who acquired it through pregnancy, delivery, or breastfeeding. And perinatal transmission is the most common way that children acquire HIV. But as we mentioned, we are inclusive of those who contracted it through blood transfusion shortly after birth or early childhood. Okay, so next slide. So this map from the CDC's website, it goes over the prevalence of people living with diagnosed perinatally acquired HIV infection through the year end of 2018. And so some significant populations are New York. If you guys can see, I know it's kind of small, but there's 12,000 at the end of year 2018, there was 12,310. And then in New York, there was 2,440 people. I think New York had the most lifetime survivors. Next to that was Florida, which was 1,512. And then California had 722. And then this slide shows through the year end of 2019. And if you can see, the numbers shifted a little bit. So it's 12,355 altogether. And oh, I'm gonna get the hang of this, guys. Bear with me. And so going back to those states that I mentioned in the previous slide, New York, New York now had it at the end of 2019, 2,398, which means the numbers just decreased by 42 from 2018 to 2019. In Florida, the numbers increased by 3. And then in California, the numbers increased by 1 from the year 2018 to 2019. So that data to me brings up significant questions and concerns. One of them being the idea that although we've made significant strides, babies are still being born positive, one. And then the question of the different regions and what access to care looks like for lifetime survivors in those different regions. And then the last one being that the concern that lifetime survivors are dying at earlier ages, and still to this day, we don't know yet. We have like about 65, a little bit over 65 members within our network, and none of them have reached the age of 50 yet. So I wanted to share that data. And this is not inclusive of babies or children who acquired HIV through blood transfusion. So moving forward to that, people who contracted HIV shortly after birth in early childhood through transfusion in hospitals, we are inclusive of their experience too. We have quite a few members who contracted HIV through blood transfusion in our network. And so with that, children acquiring HIV through medical management includes those who were receiving transfusions. Includes those receiving transfusions and hemophiliacs, excuse me. And specifically for hemophiliacs, they contracted HIV from factor VIII blood products manufactured by pharmaceutical companies. Okay, sorry. And then we put a little bit of data regarding children or babies acquiring HIV through blood transfusion. And mind you, it's really limited. So from the CDC's website, from 1979 to 1985, 10,000 hemophiliacs acquiring HIV from factor VIII blood, including Ryan White. There were 10,000 hemophiliacs. And this is folks who contracted HIV through blood transfusion, not just babies or children, but adults too. So it doesn't separate or distinguish between lifetime survivors or just and the general population. And then there were 20,000 transfusion recipients nationwide who contracted HIV through medical management. Again, it doesn't distinguish between babies or children, lifetime survivors, or just the population at large. So again, the data is really limited. And I do want to mention that the CDC states that these numbers are an estimate because some people may have died before being tested or may have been tested later, and the source of transmission is unclear. And then specifically here in California at Cedars-Sinai Medical Center, it was called Project 42, Protecting Liability from So 200 babies were infected with HIV. I'm sorry, not born, were infected with HIV from blood transfusions from 1979 to 1985. And this was before the ELISA test was developed. And I'm going to turn it over to Alex on this part to
Mhm.
share a little bit about his story and how he acquired HIV, because he's one of those 200 babies.
Yes. I guess the moral of my story is being given a gift of time. And the survivors of what happened at Cedar Sinai, um, it was a secret, and it has been kept a secret for a long time. Um, Cedar Sinai uh, didn't want to believe that there was a problem emanating from a very high risk group, West Hollywood, and they continued doing blood drives in the area without listening to CDC's guidelines. And so it made the mess a lot more, and it allowed hundreds of adults to get HIV through blood transfusion, in addition to over 200 neonates given HIV through just through medical management within the neonate. And I was one of those survivors from this. And I guess my story begins with when I found out um, at the age of 16, when I asked my mother if I had AIDS, just randomly. It was this a random thing at breakfast, and I just said, "Do I have this?" And she said, "Yes." And when that happened, I broke down. I cried. I was very emotional. My mom just sat there and watched me, and just watched me just to see how I reacted. And then she said to me, "You know, why are you crying?" And I'm like, "Because I got HIV." And my mom said, "Well, you had HIV 10 minutes earlier. You know, what is there anything different about what has happened now?" And right when that happened, right when she said that, everything just was like, okay, wipe the tears away. And it was because there wasn't any different. It was just the knowledge. And that sort of kind of, it was, I moved forward in life kind of knowing that there was something a little different with me, but I did everything that everyone else did. I played football, I swam, I did jujitsu, but it still was kind of a secret in my life, a majority of my life. And it's always kind of like feeling people out, of whom you can tell and whom would react poorly. And I've never actually had a bad reaction because my intuition has always been spot on with whom I can tell and whom I can't tell. Um, so flash forward, at the age of 25, I learned of a great injustice at what happened at Cedar Sinai by kind of just having the idea of, is there other survivors like me? And the goal at a moment was basically someone kind of asked me, knew that about my status, and then asked me the questions, do you know other people like you? And at that moment in time, I did not. And so the goal at that moment was to find other survivors like me. And it was very difficult. Um, I called Cedars. They said that I was the last one. I basically kind of was very angry. A lot of emotions were going in, a lot of anger was going towards my mother, unfortunately, just based off of kind of not having the knowledge earlier on. I felt sort of kind of, I lost something. And, but at the end of the day, normalcy is the goal of my life. And you learn to appreciate like the kind of just how you've come about, and I've learned to appreciate, but I also learned that I fought. I wrote letters. I wrote hundreds of letters to senators, presidents, because I learned that there was certain congressional bills that were passed for hemophiliacs. In 1998, former President Bill Clinton signed the Ricky Ray Hemophilia Relief Fund Act, and it gave a kind of, it just was known that FDA and federal officials consistently chose the least aggressive option when it came to the risks of HIV through medical management, like factor VIII blood, in addition to transfusions. And the hemophiliacs fought against the government about what happened. Transfusion victims were not allowed to really kind of meet each other. It was so secret. A lot of people had died. And so it just kind of, the transfusion story got forgotten about. And when I learned all of this, I didn't want people to forget. So I went public in the LA Times after meeting a father that had lost his daughter in 1992. And he basically gave me evidence of, malfeasance, collusion, this huge can of worms that kind of I got caught up in. I got really just, my focus got into the injustice of what had happened. And it was, I don't know if it was worth going down that road or if it wasn't worth going down that road, but I made it all the way down this road. And all I can say is it was very difficult. And I learned that, if it doesn't really happen to you, it's very hard to get people to jump on your bandwagon. And advocacy and power in numbers was the goal, and I just wasn't able to achieve that. And so, but I did. I fought the good fight, and it really came down to. And I read books by Elie Wiesel, by Viktor Frankl, and it is all about the appreciation of life, and you're awake for a certain amount of time during the day and you're asleep. And so for the amount of time that you're awake, a person must focus on what they're passionate about, on what they want in life. And so that's what I learned. And everything kind of transitioned to kind of being an entrepreneur, and starting to build apps. I wanted to build a dating app for people living with HIV, in addition to doing a medical app, in addition to what I'm about to do right now. I'm actually going to do a metaverse right now, showcasing 120 years of Venice Beach history, in addition to other famous monuments that no longer exist in our society, to allow users to once again see them. So it really trickled into an educational, I became an educator in the sense, and I looked at new technology as a way to tell stories. And that's kind of where I'm gearing towards right now and eventually it may tell the story of the transfusion story of what happened at Cedars and all across the world, based off of new technology that will be coming out into the marketplace very soon. So all I can say is that adversity and learning how to deal under pressure is a very it's unlike pressure builds you stronger. And right. I definitely early on in my 20s, I definitely had a lot of pressure on me in the sense of just wanting answers, getting angry, wanting justice. But 7-year cycles sort of unravels, and everybody changes after 7 years. And so this has kind of led me to what it really is all about. And it's all about connections. We are on this earth to make connections. And so I've connected with a group right now, the Lifetime Survivors Group, to be able to carry a torch with the Lifetime Survivors Group to allow people to not forget us. That's the goal, is to not forget what happened, but also for us to flourish as people and to, try to better our society. And if I'm telling my story, maybe it's helping someone else out there, you that can't speak up, or that is, having difficulty in their life.
Right.
And so that's the goal.
Thank you, Alex. Thank you. And I mean, as you can see, Alex has been a pioneer um, for lifetime survivors who contracted HIV through blood transfusion out here in LA. That's his picture from the Los Angeles Times in that article from, I think it was 2014. So, well, thank you for sharing, Alex.
Thank you for everyone.
Okay, so moving forward to our next module, our experiences. Um, we're going to talk a little bit about transitioning from pediatric care to adult care. Um, and so, hold on, I'm sorry. Okay, so this is where we've seen a lot. Well, a lot of lifetime survivors have expressed where they struggled a lot in this transition, and where we lost a lot of lifetime survivors to care, going from our parents, our caregivers, managing and taking care of everything for us, to us now having to figure out how to navigate this complex adult healthcare system on our own. Like, we didn't have any warm handoffs or um, anyone to kind of teach us how to navigate care, adult HIV care, which is totally different from pediatric HIV care. Um, and as I mentioned, a lot of us, fell through the cracks here. I think, oh, we were gonna ask the question to all of us, or to all of the panelists. What age were you when you transitioned from pediatric care to adult care?
I know me for one, I held on till the very last minute. They kicked me out of my pediatric clinic when I was 24. And I promise you, I went kicking and screaming. And I did not like the transition. I did not like what the adult side looked like versus the kid side. My clinic was set up, it's MCA, which stands for maternal, child, and adolescent. So when my mom found out that I was also positive, that's where they referred her, because we could make our appointments at the same time. The pediatric side would see me while the adult side was seeing her. And it was an easier way to make sure that the family was managing their care. When it was time for me to go from the pediatric side, they transitioned me to a doctor that I'd been familiar with because I'd seen her the whole time I was there. But I remember going to the clinic and them knowing my name when I walked in the door, and I would run in and they'd say, Lynnea, hi, how are you? And they give me hugs, and they give me candy, and they give me little gift certificates for McDonald's. The adult side didn't have any of that. And I remember going in and the receptionist would be like, what's your name? Who are you here to see? What time is your appointment? And I'm just like, where's my hug? Where's the love? Where's the care? You're not happy to see me? Like, I come from a place where they're happy to see me. And to go from that to the cold shoulder that adults get when they go in the clinic, because you're grown, you don't need the love and care and the attention anymore, right? I remember having such a fear of needles. They would numb my veins before they take my blood on the pediatric side. But in the adult side, they're just like, sit down, shut up. And like, I didn't get to cry. I didn't get my mom to hug me first before they give me this flu shot that I knew was going to hurt for 2 weeks later. It's just so different. And I swear I hated every minute of it.
Yeah, I'm like, I kind of want to add to what you were describing. Um, I mean, even with as someone going to school to be a therapist, or in my master's in social work program right now, like, even that part, like, at Children's Hospital Los Angeles, everything was in-house. So our primary care person was um our HIV specialist. Like, all of it, they all work together as a team. and the social worker for the department. That's how we were able to get spoiled, like in the way that we were spoiled that Lynnea described. Like, I remember my social worker was the best, like connected me to all kind of Ronald McDonald events, camp. I went to camp every year. I know a lot of us talk about that, like, or just being connected to the support groups for with other children who are going through the same thing you're going through at the hospital. Um, just having those resources that create that social connectedness piece, or that help with coping with the your illness. They would give us gifts every year on our birthday, or even in between, all throughout the year we got gifts all the time, like where you didn't mind having to go to the hospital a little bit more than usual, or like you didn't mind being sick, because they spoiled you with all of these resources and these opportunities for social connectedness with um you know or just like we got to make a wish, opportunities that we wouldn't have got if we weren't sick, so. And then when you transition into adult care, you lose all of that. There's no support group specifically for us lifetime survivors. There's no gifts and presents, and we're not being spoiled anymore, and we got to take care of everything on our own. So I just kind of wanted to just add a little bit like more to what Lynnea was saying. I also transitioned into adult care when I was 21. So maybe a couple years younger than Lynnea. Does anyone else want to share what age they transitioned into adult care and how the experience was?
Position
Yeah, sure, I will.
there when I
Uh,
turned 18, like clockwork. They were like, all right, you're 18 now. It's time to be a part of the adult world and do your own appointments and blood work. And, it was really scary because I just remember the one thing that they told me was like, yeah, you're an adult. No one's going to hold your hand. They're not going to call you to remind you to make your appointments. If you miss your appointment, that's on you. And luckily, I was blessed with people along the way that helped me carry the baggage and learn the ropes a little bit. And yeah.
Yeah. Thank you, Talissa.
So I think for me, secrecy was even with pediatrics. I got sick once with pneumocystis PCP, and then when I just took my medicine and went around 19, 20, 20 years old, I transitioned from pediatrics into with an adult doctor. And I always had wonderful doctors. My doctors have been just awesome all the way through. And I was basically, we were guinea pigs to all the medicines coming out on the market. And so luckily, it was just in regards to pediatrics to adulthood, and just always having the right medicine at the right time. And I've always been pretty much healthy all the way through, luckily.
That's good. Thank you for sharing, Alex. Um, so how to adult? Um, a lot of us lifetime survivors are now currently thriving in our careers with families and the whole nine. However, I would be remiss if I did not mention those who struggled to find work, maybe because the virus has affected them physically, um, or cognitively more severely, or those who have had maybe to navigate the foster care system and who struggled to find stable housing, or employment due to not being provided with the right resources, guidance, or positive role models in their lives. Um, and so, we know like a lot of the times that the system and all of its policies and procedures, like to be connected to these resources that help with stable housing, um, that provide housing services, or like all that mental health services and all that stuff, sometimes those things these systems can create barriers. Um, and so I think Talissa wanted to talk on this part about um like having like some of the barriers she's experienced with trying to work and having too much money to qualify for um like certain resources.
So growing up, I always wanted to be a motivational speaker and a dancer. And my mom's like, honey, that's great, but like, let's do something that you can kind of fall back on, right? So I'm like, okay. She's like, maybe you should be a nurse. I'm like, okay, that sounds good. I can get into the nursing field, medical. I can use my platform to reach out to people for education. And my whole dream was to become a nurse to work at my local clinic. So after 9 years, I finally land the job and I'm like over the moon excited about this. I want to learn everything. I'm here, I'm there. Unfortunately, I think my enthusiasm kind of got misread and it wasn't the best fit, right? So I got let go unexpectedly. And, unexpectedly means like your girl over here didn't have like her stuff in order so much. So I go and I apply for Hopwa, and Hopwa's like, "Oh, well, you have some money in your bank," and I'm like, "Yeah, well, you know what? I kind of saved for a rainy day, but this isn't gonna sustain me." So I had to like jump through hoops of fire to talk to supervisors, to talk to different managers, to be able to bring this person that was like acting as a gatekeeper to these funds. And at the end of the day, I never got the support that I needed, A, from the community that I'm a part of, and B, from, being fired unexpectedly. And that was a really hard transition right there. And I I don't think that we are quite set up in the way that we should be to support people in these types of situations.
Yeah, I like Talissa's experience is like highlighting the fact that they want you to like to qualify for like for example, if you make too much money, then you or if you make a I don't know how to explain what I'm trying to say. Well,
If you make too much
you gotta
money, you need support from the community, and but these things are in place for people like us to help us in the times of needs because sometimes it is hard to find a job when you're between looking for work, and the funds are there,
right
just
too.
make
Yeah,
it to access them.
yes, yes. Sorry. I was trying to say like, you got to be making like below the federal poverty limit to qualify for these resources, like to qualify for Medi-Cal or but if you make a little bit too much money to where you're like just barely over the limit, it's
You're
like
being
you don't
punished for
qualify for it,
responsible.
I'm sorry.
It's
I
almost like you're being punished for being responsible.
Right.
I have a career
Yeah.
that I
When
wanted to pursue that.
you're saying making too much, it's not even about what you make. It's like, what do you have? If you have a pot to pee in, you don't need the window to throw it out of, basically, is what they're saying. So
Exactly.
it's like damned if you do, damned if you don't. You can't try to help yourself and then expect the help from the things that are there to help us. It's just
Exactly.
horrible.
Exactly. I know a lot of us have talked about like the experiences we had with receiving Social Security disability as a child. And then, when we turned 18, it coming to us. And then when we finally started working, um, like having them telling us they overpaid us, and having to pay that back or like within these conversations, like the ADAP financial cap gets brought up. Um, to qualify for OA HIP, there's a financial cap on that too. So again, we can't make too much money to qualify for these services that we need. And even just with the system today, like with the inflation, with how much things are, like, you know, I think we just, those caps and those, they need to be moved. um, but thank you guys for sharing. Um, moving forward into the challenges of growing older with HIV. Since we're on this slide and Hydea is on here, I wanted to channel my Nestor energy and talk about tokenism and kind of how um like our HIV advocacy, direct service and advocacy field, we feel like failed, like this the systemic failure we were talking about, how it failed Hydea. So tokenism, I like looked up the definition of it. It's something that a person or organization does that seems to support or help a group of people who are treated unfairly in society or left out, such as giving a member of that group an important or public position, but which is not meant to make changes that would help that group in a lasting way. Or, in a different way of saying it, making only a symbolic effort to do a particular thing um, for underrepresented groups in order to give the appearance of like sexual or racial equality within the workforce. And so like I'll never forget this conversation I had with Martha from the USP, the caucus, the people living with HIV caucus, where she said she was talking about Mary Bowman, who also passed away a couple of years ago. And she said what most people didn't know about Mary is that she would come to these conferences and recite her poems and be recognized for her work and be a star, but then would go home and be dealing with homelessness and mental health issues and adherence and etc. And so to me, this seems to be a pattern, and it just brings up to me the systemic failure to help Hydea. Um, about a couple of years ago at the USCHA, she showed up like completely in her trauma. And I feel like our system wasn't equipped to really help her. And so we want to like acknowledge that and just take a moment, like just a brief moment to acknowledge. Oh, also, not just that, but like she really didn't even get too much mention or acknowledgement at the USCHA this past year. So we just want to we will continue to do this, take a moment for her and Tiffany and Mary and Kalea and all the lifetime survivors that we lost. It's all for the same reason. um, I know we're like running, we gotta be mindful of time, so I'll keep going forward. Um, so again, back to the challenges of growing older with HIV. So a lot of these things, the common comorbidities we experience aging with HIV since birth, we're experiencing these things: cardiovascular disease, kidney disease, liver disease, all these things at much younger ages, in our 20s, in our 30s, and even younger than that. Um, sorry. Um, so a lot of us are taking vitamin D because of bone density loss. A lot of us have experienced lipodystrophy or like weight gain from being on the older medications, hypertension from prolonged inflammation. Um, yeah, like let's not forget to talk about how our liver, um, how hard it is for our liver to filter these meds. And a lot of us have experienced kidney failure or renal failure. Um, I think right here, Talissa wanted to share her experience of weight gain?
So for me, I know that the meds make me bloated and I carry a lot of extra weight in kind of my midsection. So I wanted to see GI and see maybe what was going on there. And without many answers in that department, I got onto the semi-glutide, kind of like Ozempic or Wegovy, and that really helped with the side effect of the meds. And I just I came to my provider with this issue over and over, and it was just kind of something that just kind of kept getting overlooked. Like, and try to diet, try to exercise, do this, or try this type of exercise to try to bring your abdominals together. And I'm like, yeah, I've been there, done that. I've done everything under the sun, and nothing's really helping. So I just kind of had to take matters into my own hands and figure out what worked best for me, which was being on the semi-glutide, and while taking my meds definitely has helped me in, I guess, the difference in the lipodystrophy of the way the fat is distributed in my body.
Yeah. I don't know if it's like, I know some of the newer medications are getting better with that, but some of the older medications um, definitely caused a lot of weight gain. I think I'm on Biktarvy now, and I feel like that has a little bit of it causes a significant amount of weight gain too. um, yeah, that's thank you for sharing, Talissa. I think Alex, you wanted to share your experiences too of um
Adherence to medications.
yeah, I think so.
Yeah,
The
so
effects of
as
medication.
stated, I was sort of the guinea pig of medicines coming out, always kind of like 5 T cells, 20 T cells, and then bam, new medications came out. T cells shot up after taking them. And one particular medication, I guess, through college, I gained a lot of weight, and um, I went home for summer, and my best friend says to me, "You're fat." It's like, we're gonna get you to the gym. So at that moment, probably senior year, I also got into athleticism, and from the gym, I got into martial arts, and it just kind of like this kind of a wonderful thing kind of happened in regards to my health. I've always was pretty healthy all the way through, but just in regards to immune system and keeping in shape, just it helps me mentally, it helps me physically, and just I can't go a day without doing some jumping jacks or push-ups.
Yeah, I think we definitely, as people who've been living with it since for our entire lives, have to be more mindful of the things we eat and being more physically active, which I know I don't do a very great job at. So I'm super inspired, Alex, by you and others within our group. Like, and I need to.
We're going to do a fitness class, Black Survivors fitness class, very soon.
Yeah.
We're going to start. That'll be the next seminar.
Um, okay, thank you for sharing. Let's go to mental health for lifetime survivors. So, people with HIV of any age are twice as likely to experience depression um, than those who don't have HIV. And so, people, lifetime survivors, obviously, um, due to the trauma that they've experienced from, or our unique trauma that we've experienced from aging with HIV. This mental health piece is really important for us um, to make sure we're paying attention to and assessing in lifetime survivors. Um, and then the next bullet point talks about HAND, which is HIV associated neurocognitive disorder. We call it HIV brain. um, Again, because of the fact that we were living with HIV in our developmental stages from 0 to 5. Um, like a lot of these things we're experiencing at younger ages. They say that this neurocognitive disorder comes as you get older, but we're experiencing it now, some of us. Um, let's see. Don't I'm sorry. I'm losing track of my notes. Here we go. I don't think anyone wanted to share here, so I'll skip. And so with that, um, the recognizing that our trauma from our experience may run a little bit deeper, and I think Alex wanted to share about the trauma of finding out about his status, or just the details around finding out about his status, and some of the PTSD and trauma that caused.
Yeah, I think the most difficult part of was becoming a teenager and watching people around you date and kind of figuring out ways of wanting normalcy in my life. And I guess I found my first girlfriend in college, um, and it was it was very difficult to explain my condition to her, and it basically was a safety situation, and I just was very safe the entire way. And then um, later on, around 25, after this girlfriend, is when I kind of became more comfortable with my situation, disclosing my condition. I wouldn't say that I was the best. Everyone is in their own, and disclosing your HIV status in college was very, very difficult for me. And then after 25, I promised myself that I would never, I would always disclose. But that's kind of my story.
Thank you, Alex. Did you want to? I know you were mentioning talking about like just. I know you shared it at the beginning a little bit too, but you were kind of like just mentioning the trauma that you you know
Yeah.
finding out
So
the details about your how you were diagnosed.
yeah, it's the trauma of finding out, and then secrecy, and then kind of seeking assistance from my politicians to look at what happened at Cedars. And I wanted a congressional investigation by the FBI, in addition to a subcommittee. I wanted an investigation of what happened at Cedars. I mean, hundreds of people got AIDS through Cedars, and everyone just forgot about it. And so it just was a very, I had to cope. I had to deal. I had to move forward. I have hundreds of letters. I mean, I kind of like was, not going to show, but hundreds of letters from politicians for a 4-year period, as I carried a torch to seek questions, seek answers, and basically everyone stonewalled me, and I had to pack it up, and so I did so, and kind of use that energy into more useful areas in my life, like being an entrepreneur and building apps, and kind of. But I remember, horrible things that women have said to me after disclosing, and just it's one woman said to me, if my father found out you were HIV positive, he would commit suicide. And that was probably one of the worst things anybody's ever said to me. And that's how I broke. That's how we broke up. And so yeah, just these certain things, I guess, traumatized, and kind of like taking that experience to the next relationship and hoping for the best, that it won't turn that way. But obviously, time with somebody, and you learn, you learn about the layers of somebody over time, um, and people under pressure say stupid things, or we all have been angry at times in our lives where we've said stupid things based off of that. And so um, I feel like HIV was a tool to be able to pick on me, and always kind of be like, whatever happened, like whatever argument was going on or whatever, I would always lose the argument because she was accepting the fact that I was HIV positive. And so it was a very, that's just my experience.
Yeah, yeah. Thank you for sharing, Alex. I think also Lynnea wanted to share her experience on domestic violence or intimate partner violence.
Yeah, so this share kind of goes hand in hand with this slide as well as the one prior to, talking about mental health. There are studies that show that there's a greater prevalence of intimate partner violence or domestic violence in women who are positive, because getting that diagnosis takes a stab at your self-esteem. And low self-esteem is one of the highest contributing factors to becoming victimized by intimate partner violence. Now, you can imagine going from having a life that did not involve HIV, then being diagnosed, then having that shot to your self-esteem, and then moving forward. But as lifetime survivors, there is no positive, good moment of life when your self-esteem is at its best. You've always have this shadow of something that's making you not worthy or less desirable. So then you find this partner who's willing to accept you, and you feel that that's what you deserve. I know for me personally, I went through a few very toxic relationships, and I stuck around because I would always in the back of my mind hear my own self stigmatizing me, telling me, you're not going to find anything better. No one else is going to accept you with HIV. This is what you deserve. You have to make this work because who else is out there? You don't know if you're ever going to have another relationship. So just having that from a young age and going through the high school dating, I found out when I was 7 that I was HIV positive. So before when I still thought boys had cooties, I had this thing in the back of my head that was telling me like, yeah, the boys are nasty and they have cooties and they're not going to want you anyway because you have this thing. So when I did find that person that was like, hey, you're kind of cute, I didn't even think the boy was cute. My first boyfriend was ugly, but I didn't think I would get anything better. So I was like, oh, he likes me, I'm in love. And that's not healthy. This boy did every and anything to me. He cheated, he cussed me out, he was horrible to me, but I didn't think I deserved anything better. And it took me a while to move out of that mindset and to get to a place where I am now, where if you can't accept the worst of me, you don't deserve the best of me. And I mean, I don't know what flipped in my mind to make me see that, but it took a long time. And I can imagine that for other people who are born positive and who have that negative self-talk, that's something that they have to learn as well. So I just wanted to mention just how that post-traumatic stress and the trauma that's associated with those 3 letters can really have an effect on every aspect of your life.
Yeah, most definitely. And thank you, Lynnea, for sharing that. I know, like I said, we don't have no pre-diagnosis identity to refer to, and I know in this work that I've we've been doing, um, like I get that from long-term survivors or from newly diagnosed people, like when they're that um devastation that they feel when they find out that they have that they have this, and what that means moving forward. We felt that our whole entire lives. So thank you for sharing that. Yeah, so that, like, again, highlighting that our trauma and our PTSD, is unique to our experience and maybe a little bit deeper. Or a lot of bit deeper. Um,
Oh,
oh, sorry, did you want to say something?
well, I was just going to say about PrEP. So
Oh, yeah.
PrEP is a medicine that serodiscordant relationships they can take, where one is positive, one's negative, and you can actually, it's the chances of transmission is very low. I had a situation where the condom broke, and it was like hysteria, getting her to an emergency room to get these medicines in her. And definitely in regards to trauma, it was it was hell. And so she had to take these medicines that were highly toxic, and I had been used to these medicines, and I just being empathetic and sympathetic towards what she was going through, and the emotions, just it was a very stressful, emotional situation, that definitely I wanted to bring up for PTSD for me, an experience that I had.
Thank you, Alex. I think that was, so you brought up PEP and PrEP.
Mhm.
And then also treatment as prevention, U equals U. I know, just kind of turning it around from, because what you guys shared was heavy, like, but I think that U equals U was really like a game changer for us, and just the HIV community at large, because it kind of changed the game in regards to like empowering us to feel like we're not this infectious, we can get, we're if we take our medicines, we're undetectable, we can't transmit the the virus, and we're not this infectious, um you know na-
Have
or
the cooties. We can't.
yeah, we don't have the cooties. I didn't want to say nasty or whatever, but not this infectious thing, so I know that that was a game changer, a turnaround in some of those feelings that Lynnea was bringing up about feeling like, I'm not going to be able to find, or the low self-esteem, should I say. um thank you, Alex, for bringing that up. Um, so we also wanted to tie in, talk a little bit about substance use and our relationship with substance use. A lot of the lifetime survivors in our community, were born positive, um, and are, due to some of our parents dealing with substance use disorder. So, not only were they born with HIV, but from the effects of being born, from a mother who was addicted to drugs. And so, that's a whole nother layer added to it. Um, and so, we just wanted to highlight that healthcare providers should ask lifetime survivors, patients about their use of alcohol and drugs and help them access treatment if necessary. Okay, and then moving forward to a snapshot from our life. A lot of us experience the loss of a loved one, whether that be like our mother, our father, both, our siblings, our friends. Um, and so that also impacted us, in a real way, And I think on this part, Talissa wanted to share her experiences about being adopted.
Okay, so um, I lost my mom 7 years ago, and she adopted me when I was a year old. And talking about trauma and the PTSD that comes along with being positive, that was kind of the straw that broke the camel's back for me. You know, I could white knuckle the fact that I was HIV positive because luckily I've had great people surround me and support me in the things that I've chosen to do. Um, but my mom adopted me not knowing that I was positive. She was a friend of the family. She couldn't have kids of her own. Um, so her and my dad went to go see me and they fell in love. And my biological mom didn't show up to court to like I guess take me back from the the guardianship that my adopted mom was looking for. And so I just got sick all the time, and my adopted mom didn't understand why. And I got pneumonia, landed in the hospital, and through that was when I was diagnosed when I was 5. Um, so to lose both mothers, because then my biological mom, she had dementia as an opportunistic infection by choosing not to take her medications. She died when I was 5, and I never got a chance to meet her, but I'm told I'm a lot like her. Um, and just kind of dealing with the loss of people who are supposed to, you know, show you love and support in a community that's not accepted well on the outside. It can get kind of lonely, and it does uh, mess with you a bit. And yeah, it's losing people is hard in the community, especially with Haidia and Tiffany. You know, you see yourself in those people, and you know, yes.
Yeah. Thank you. Thank you for sharing that. I think like it's important to recognize that like our family dynamics within the lifetime survivors community may look different. You know, a lot like I said, a lot of us have lost our biological parents, um, and may have grown up with adopted parents or, you know, in foster care. And so um just like also being mindful to have conversations around that, like how we cope with our diagnosis, um and our parents diagnosis at the same time, especially if it's like, you know, our parents are no longer here, or you know, watching them have a hard time coping with their diagnosis or struggling with substance use or whatever the case. You know, um seeking advice from parents or caregivers, adopted parents who may not be comfortable, um, like talking to us about our status, or if they are positive, comfortable with talking about their own status, you know, and then just what disclosing to children may look like, and you know, like how it that can be different at different ages. I believe, let me see. Oh no. Okay, I thought somebody else wanted to speak, but no.
Yeah, I'll speak. Speak on that experience
Okay.
of this disclosure. I mean, like, mom, my mother wanted normalcy in my life, and I only had 2 episodes of health that were, um, pretty scary. One is PCP pneumonia, pneumocystis, which is an opportunistic infection that HIV positive people can get. And I was in the hospital for over 2 months, and my mom made sure that there was a note on the door that stated, this patient cannot know his diagnosis. Any nurse, any doctor coming in and out of that room was not allowed to talk about my HIV status around me. And then obviously flash forward, um, I find out at 16. And so I'm very, I don't know what I would have been like if I had found out earlier. But anyway, that's kind of my story.
Thank you, Alex. So we talked a lot about trauma and PTSD, and so we kind of want to end it on a high note with talking about post-traumatic growth. Um, and so, the definition of that is it's um, describing this positive psychological change that some individuals experience after a life crisis or traumatic event. I honestly, the I don't know any more. Well, all of us living with HIV, right? We're some of the most resilient people you'll ever meet, but specifically lifetime survivors. Like, man, we've been through so much, and we just continue to live our lives and create our families of choice. And I think Lynnea wanted to share her experience of the turning point in her life, um, her turning point in her life.
Yeah, definitely growing up, seeing the people around me who I was closest to, who I shared this story with, kids I went to camp with, watching them pass away and having been to more funerals before I was 20 than some people had ever been in their lifetime. I remember at about 22, 23, a friend of mine lost her grandmother, and she didn't know. She was just tore up because she never had someone that she knew die before. And I was like uncomfortably comfortable with the process of what happens after someone dies and trying to coach her through it. Like, there's going to be a funeral, the body will be there in a casket or not. If you want to go look at it, you can. If you don't want to, you don't have to. You can go up and say something if you want to. If you don't want to, you can sit down. However you need to deal with it, it's how you deal with it. I felt at that moment that there was something wrong with me. Like, I shouldn't be this comfortable with death. And I remember being so comfortable with death and expecting my own, just anticipating my own death. I was just obsessed with taking pictures. So I'd always have an updated picture that I approved of to be on the front of my obituary. And it wasn't until I was 25, 26 that I realized I wasn't dying. And I made all these mistakes. Like, I dropped out of high school as soon as I was old enough to be on the streets without getting stopped by the police, because I thought I need to go get a job so I can make some money and buy the things I want before I die. I had to deal with all that. So it took until about 25 when I realized you're not dying. You gotta start thinking about living now. So I went and got my GED and started getting on the right path to making something of myself. And still just thinking it was just, I gotta take care of me. My best friend asked me to be her son's godmother. And the way she asked me was, she was like, I know you think you're not gonna have your own kids, but I want to share my baby with you. So will you be his godmom? And I swear the tears was like, oh my God, now I really need to become something, because this kid's gonna be looking at me. And how am I gonna tell him to make something of himself when I haven't made anything of myself? And a year after that, I got pregnant and had my own child. So it just took that light bulb, that light bulb coming on to say, you're not dying. And that's when I feel like my post-traumatic growth started, when I started thinking about tomorrow and next year and 5 years from now and 10 years from now. Here I am, mother of my daughter will be 10 on Thursday. My second child will be here in March. I'll be 40 next year. All of this good stuff coming from me, preparing to live instead of thinking about my own demise.
Thank you, Lynnea, for sharing that. Talissa, I know you wanted to share your experience too of your turning point.
I think it was when I heard some advice, something like uh, to love yourself the way that you would as a new crush, right? Because we talk about self love and self care, and what does that even look like? What does that even mean? Okay, so when you have a new crush and you're like, oh yeah, I want to look pretty, or I want to, okay, so that giddiness, turn that into something for yourself, right? Because the stigma that comes with being positive is just, it tears you down so bad that right, we don't feel worthy to love ourselves or to feel good about things. And so, get that outfit for you. You like that new lipstick? Get that for you. If you like what it looks like on you when you look in the mirror, impress yourself. um I think, and I can agree with kind of just aging, getting older, and just realizing, like, okay, I lived another year. All right, I'm a little healthier this year. I'm living another year. Okay, right. So we're doing this now. Like, we're in it for the long haul. And it wasn't until I was 30 that one of my cousins told me that growing up, they kept telling the family, like, every year I was gonna die. They're like, 16, yeah, you're not gonna have her for 17. Yeah, 18, yeah, you're not gonna have her for that. 21, I guess she's here. She's gonna live, right? So thinking about the living versus dying aspect, I think I hit the ground running. Like, I was just in it, school, work, being active in dancing, and just trying to do all the things that I could in my youth. That yeah. And then again, to bring it back to the straw that broke the camel's back, it was like, okay, now you have to sit and think about what you really want to do with your future, because you're still here, and now mom's not here. So who are you as a woman moving forward with your own ideas and your own dreams without having someone there to guide you and show you the way, and kind of give you their advice. So I think the self love and turning inward, and reminding myself to love myself as I would a new crush is what helped me move forward in being excited about living.
That's right.
And
Thank
I
you.
have something to say.
Okay.
Everyone has the right to choose how they react under pressure and adversity. And so I never thought in a million years, I think I'm going to die at age 90, 100 years old. I never thought I was ever going to die of AIDS. And that's a choice that I made in my head. And so luckily I've, the books, reading Eli Weitzel and Viktor Frankl has definitely put a different perspective, and listening to adversity of other people, how they dealt under pressure in their lives, definitely trickled into my life, and it has helped me a lot.
Thank you. Yeah, I hope that's the goal, right? We all we make it to 100. I hope I hope the same. Um, okay, thank you, Alex. Thanks for sharing, guys. Uh, so the finding community healing. I know Alex touched on this a little bit. Um, so that social connectedness piece, guys, is like super important. Like, we find healing through a community, and the idea that we're not alone. And so um like it says it's possible to increase or build from scratch a social network. It takes work and it's not easy, but the rewards are huge. And I'm like, that's one of the reasons why I'm super like proud and grateful for this network, and how far it's grown, and the fact that we're reaching more lifetime survivors who like in that map at the beginning that we showed it, we got a long way to go to get to that 12,355, to reach, that number of all the lifetime survivors here in the States. And that's just here, not to mention internationally, like, so I'm just super excited. Moving forward into, and I'm going to try to breeze through these because I know we're like getting close to time, staying healthy. Um, so this part, we wanted to kind of steer away from the normal like language of trying to push adherence and um, you know, but that it's our choice and our decision. And we're being mindful about that because for a long time we were guinea pigs, minors who couldn't make decisions regarding our treatment and medication. And so now that we're adults, like, you know, again, it's our choice, our decision. And then also from being on those older drugs like AZT that led to a lot of the health challenges that were developed. Um, you know, not saying like we're not encouraging at all like for folks not to take their medication or anything like that, but again, um the autonomy and the agency to decide, what treatments are right for us, um and whether or not we want to take them or not. We wanted to kind of highlight the polypharmacy. The I know we don't have to talk too much about this, but the fact that we are taking multiple medications that for not just for HIV, but other things that might interact with each other. So it's important to um, talk to your provider or your pharmacist about like the drug interactions um, of the medications that you're on. And we just wanted to highlight some adherence challenges. So a lot of the people in our network have discussed like wanting to take medication breaks or medication holidays, because they experience pill fatigue just from being on medications their entire lives, or from, you know, to minimize the side effects. Some of the reasons why people have not been being adherent to their medication is because the fear of people seeing their medication and the risk of disclosure, or the fact that it reminds us of our status. And then just with being too busy, um, and then the challenges in life. So, how can we prioritize taking our medicine when we're homeless, or when we're struggling with severe mental illness or substance use, that kind of thing. Um, and then what does it take to stay healthy? So, especially for us living lifetime survivors and long-term survivors living with HIV, it's important for us to exercise regularly, um, and that can improve both our physical and mental health, and to be mindful of what we're eating, what we put in our body. A healthy diet is key. Um, we put this picture of Alex because he's into jiu-jitsu. Am I saying that right?
Well, this particular picture is me doing Krav Maga, which is
Oh,
an Israeli martial arts.
and I think you wanted to share some of your wellness practices.
Um, I think eating healthy and taking your medicine and kind of making sure that your heart's beating a little bit faster throughout the day kind of clears my head up. In addition to also speaking to a therapist, and there's a whole regime that someone in my shoes has to do in order to manage a normal life, and that also means trickling into good mental health. Somebody must exercise in my situation in order to keep the mental health um, afloat, and just if I feel stressed out or I feel depressed or whatever, if I run, I'm no longer depressed and I'm no longer stressed out because I'm exhausted. And so exhaustion is the best way for me to deal in regards to my stress.
Thank you, Alex. All right, I think this is the last section, sex and love. Um, where are we at? Sorry. Um, so there we put some myths on here um about sexuality and people living with HIV, and these are some of the things we have felt and experienced growing up, from childhood to adolescence, feeling like, um, that you can't have babies if you're HIV positive, you can't be in a relationship if you're HIV positive without passing it. Um, Hearing some of these things like you don't look like you have HIV. I know definitely when I was in middle school, a lot of people thought you can get HIV from kissing, or just the fact that people think you have to have that, a myth, that the myth that people that people who are HIV positive were hoes or contracted it through promiscuity, um, etc. And we wanted to put this, so taking a sex positive approach to it. HIV, one on sex education should be taught from like a sex positive approach, and it should be inclusive and comprehensive of all the experiences of all of us, regardless to our gender, identity, sexuality, or HIV or STI status. And we should avoid scare tactics, and discuss prevention options, um, and also talk about sexual pleasure, because we do deserve, people living with HIV, to not just have healthy sex, but also pleasurable sex. And how important it is for you to talk to your providers, your medical care providers, about your sexual health, and ask those, be real with them, and ask questions, and include the concerns about like physiological changes that can impact sex. And I believe um that Talissa wanted to share her experience around her fears of dating with HIV and disclosure.
Um, I think this is like the $1 million question in HIV, is the the disclosure, when and where and how, and um, it's, I think how Alex kind of touched on earlier, it is a lot of trying to gauge somebody and see if they are able to receive this information and understand it, and how willing they are to continue to educate themselves on the topic. Because I can definitely write a book about different things that I've either heard through friends or things that I've experienced myself. Um, some of them are kind of comical, and then others you're just kind of like, ooh, all right. So, yeah, that's not a great situation. I disclosed one time and the guy was like, oh, you're joking, right? And I'm like, no. No, why would I joke about something like that? And if you meet someone who jokes about something, you might want to like run and like fast, because that's a whole different type of situation that I don't think you want to deal with. But yeah, disclosing is definitely a tricky part the of living positive, because I think on a day-to-day basis my life is pretty normal. It's just this like extra thing that it's like a maintenance to my life. And yeah, it's definitely interesting the different ways people receive this
Mhm.
information, and disclosing your status with them. But I think it's important to us living positive to also know kind of the language, or at least where to point these people in the right direction. Like, hey, go see your primary care, ask them about PrEP. Condoms are the safest way to keep yourself safe, not only from HIV but from other STIs. And um, at least having some kind of lingo to know where to direct people if they aren't really sure, because sexual
Mhm.
health is important. I'm pretty sure that majority of people don't ask the whole like work up a questionnaire. When was the last time you were tested? When was the last time you had chlamydia? Did your chlamydia clear up? Like, so knowing where to how to keep yourself sexually healthy is important. And yes, and that goes hand in hand kind of with disclosure, because we go from one, hey, I'm HIV positive, to hey, by the way, you can go to the clinic, you can get PrEP, you can use condoms, this is where you can pick up. Yeah.
I'd like to add upon that. I believe that people in the heterosexual community would never think in a million years that they would be in front of someone like us. And I believe that they're shocked when they hear of a disclosure. And it would probably be the first time in their lives that they ever heard someone disclose their HIV status. I don't think the average person has met other, I mean, I don't know. I'm saying
That they
that.
know of anyway. You know,
Yeah.
we're able to tell what our status is. Someone may not, be able to do that because, right, they don't know how to keep themselves sexually healthy, and they've never been tested, and they're walking around with something that they just aren't aware of. So when you disclose, it's sometimes, yes, we are the first person to have that conversation with them, but we may not necessarily be the first person that they have encountered.
Right.
That makes sense.
Right. Yeah. Thank you guys for that. Yeah, I think disclosure isn't black and white, like the idea of when you're supposed to disclose, like is it right when you first meet the person? Is it, you know, after you get to know the person? Like is it obviously before you become intimate with the person, but like again, all of that isn't black and white, and it's for it's it can be different for different people, and it's up to us to decide, so those conversations get interesting.
They do.
um,
They do.
thank you guys for sharing. Moving forward to pregnancy or parenthood and pregnancy, and then we all oops, sorry, parenthood and pregnancy. um So that myth that HIV positive people can't have babies, obviously so many people I know in the HIV advocacy world have been busting that myth and definitely are like have full on, marriages, families with serodiscordant or with a HIV negative person, and their babies are being born HIV negative. And so, we wanted to add this slide on here to address breastfeeding and how to destigmatize that for birthing parents living with HIV, creating a stigma-free prenatal and post creating stigma-free prenatal and postnatal care and wraparound services for the birthing parent and child, disclosing and also disclosing to a child. And we're saying birthing parent because we know that not just women can have babies, but also um, trans men who were born women and are now um, have transitioned into a man. So we wanted to be inclusive. And I know Lynnea wanted to share her experiences of um, giving birth to the kid.
Yes, the kid. I affectionately call her the kid. But yes, my little girl, Naylin, she's such a joy. And I'm saying that through gritted teeth. Such a joy. Have a 10-year-old, and you'll know why I'm saying it through gritted teeth. But it was such a struggle just being pregnant and trying to be happy and sitting in that moment and just enjoying the miracles of my body creating a little person. I remember telling some people and hearing them say, why would you do that to somebody else? What's wrong with you? And just being taken aback, like, what am I doing? What am I doing? What is it that I'm doing that's so wrong? I'm doing what God created me to do. I'm being fruitful and multiplying. Just having the stigma put on me that other people held, even within the HIV community, hearing other women tell their stories of being forced into abortions because they were told that their child was not going to survive, hearing people tell me their stories of how they were so shunned when even mentioning the wanting to be a parent that they just decided that they it wasn't for them. Parenthood was not for them. And then going through the process of giving birth to this little person and being in the hospital, hearing the doctors trying to educate, because I went to a teaching hospital, so they're trying to educate the student, the residents, or whatever you call them, the people who are still in school, trying to educate them on what's going on with my body and what's going to happen to my child, and hearing them ask questions right there in the room with me that made me feel really uncomfortable, and just having to choke all that down and still enjoy the process. It was the hardest thing I've done. And then after going out into the world with my child and hearing everybody and their push for people to breast and chest feed, and knowing that there was a reason that I was told not to. And then hearing people tell me, oh my God, you're bottle feeding, you're giving your daughter formula, you're not doing what's best for your child. And trying not to cry, thinking that I am doing what's best for my child. I was told it's a possibility that I could transmit to her if I breastfeed her. So I'm doing what's best for my child. But these people on the outside looking in, they didn't know what was going on with me or why I chose to bottle feed over breastfeed. Now having people trying to encourage and push me to breastfeed, because like I said, I'm expecting child number 2, and having to make that decision on if that's something I want to do or if I'm going to still choose to bottle feed. It's just, there's always so much that's put on new parents, even without HIV. Adding HIV on top of that, that's a whole nother layer that just makes the whole process make you want to pull your hair out. It's like this time I didn't even go on social media and say anything about being pregnant. There's so many people who don't even know. I have family members that are like, you didn't tell us. And I'm like, well, they just see me and they're like, are you pregnant? Mm-hmm. Oh my God, you're really pregnant. Like, we see your belly all right. Why didn't you say anything? I didn't have to. It's not your business.
Right.
Oh yeah, and then really quickly about disclosing to the kids. I go about it the same way I go about disclosing to other people who are going to be in my life. I used to do this thing where I tried to wait around and see if someone was worthy of my news, to see if it was something like, oh, are you even a person who I want to have around in a year? Like, I'm going to give you a chance to get to know me first before I hit you with this bad news. I'm at that point now in life where I don't care what you think about me. So I tell everyone up front, and I chose that same route with disclosing to my daughter. She's known from as long as I can remember. I've taken her to places where they're talking about HIV. I told her about myself. Every time we see anything about it, she's like, Mommy, you have that, don't you? And I'm like, mm-hmm. And just being the first one to educate her and inform her, I feel like was the best way to go. That way she's not getting the misinformation and the stigma from outside places. And she's prepared to go into the world knowing the right way, how to deal with other positive people, and that this is something that's not going to negatively affect her.
Thank you. Thank you. Thank you. Thank you. And thank you to those who are still on. I know we're a little bit over time. We are wrapping it up now. Um, so just a little bit about our network. We're a national network of people living with HIV since birth or early childhood. Our mission is to advocate for healthcare policy changes and make sure we are included in the development, decision-making, delivery, and evaluation of the national Ending the HIV Epidemic Plan. Our vision is to increase awareness about the impact of HIV on people living with HIV since birth or early childhood at every stage of the HIV continuum. We started as the Vertical Special Interest Group in 2019. We were within the National HIV and Aging Advocacy Network, and since then, we have branched off. And this says we need to update this that we've been working on. Actually, no, this is correct. Building out our infrastructure of our network, where we've developed into our own network organization outside of NMAC, and we're currently creating our bylaws. And yes, So in 2024, we announced ourselves as our own independent network organization, and MAC is our fiscal sponsors. Um, our membership is open to all people living with HIV since birth or early childhood. And this is our network application. If you guys want to screenshot this, write down the bit.ly. If you guys know any lifetime survivors, you guys can connect them to our network and have them fill out our application. Um, and then how to contact us. This is our email if you guys want to screenshot this, and you can follow us on Instagram. um, and I guess now we can open it up to those who are still on. Again, thank you to questions, and we can open it up to QA. Feel free to put your questions in the chat or come off mute, raise your hand. I'm gonna stop sharing my screen.
Well, I can introduce myself. My name is Marcella. I won the iPad at the Washington D.C. conference. That's how I know about y'all. And I've been
Oh,
positive since '99. I was 18 when I was diagnosed. I'm 43 now. And my newly task I'm doing is actually talking about my status and coming out. So I actually just told two new friends and they took it well, which I was not expecting at all, but they took it good. And it wasn't a problem. We was actually able to talk, but I am an advocate. So I kind of know how to talk a little bit. I'm still a little scared to put it out there because you don't know how people reactions and how educated people are. But that's just something God got me doing right now. I got to step out there and trust Him with letting people know up front. And that's what I started. That's my new start for this. And thank y'all for having us and talking about it, y'all situations.
thank you, Marcella. Thank you for sharing space with us. And thank you for also sharing space with us at the USCHA. I don't know if we got to like meet you there, but nice meeting you now. Does does anyone else have any questions? I don't know if there was any in the chat.
Maybe just a question. My name is Gail. I am here for my sister. I think you have been talking to her probably on messages. Larissa, she lives in Cameroon. And I've been fighting the battle. I think I just took a step back because now I'm not local anymore. But I grew up with her situation since birth, and it was definitely a roller coaster. My main question here will be, how do you have any partnership or any collaborations with NGO or nonprofits that are outside of the US? Because she really enjoys the group. She's really having a lot of benefits just belonging to the community. But my goal is for her to thrive, right? She doesn't speak English. That's probably why I'm speaking here on her behalf. But it will be good to have that kind of initiative in Africa where she lives. So if you have any contacts within that area that could help, or if you guys are doing any collaboration, it will be also good to know. We don't have to have that conversation here. We can have it in email just so that we don't hold anybody on the call. But yeah, thank you for the initiative. I was hearing the experience. I'm like, yeah, we went through all of that, the losses, the trauma, everything. So I just didn't want to overwhelm the chat. But thank you so much for sharing it, and thank you for having this platform where people can express themselves. So yeah, I feel like I talk a little longer, but that was my question.
No, thank you, thank you. We love Mina. um, and yeah, no, we're still trying to make those connections here in the States. And we have a long way to go still here, but we definitely are interested in expand, like we don't want to just be just reach lifetime survivors nationally. We want to reach all of us internationally too. So I'm definitely open to continuing to talk with you and um, just other agencies that we're working with on how we can make partnerships in Africa or just on a national level. I don't know. I mean, on an international level, I'm sorry. Do Lynnea or Talissa, do you guys have any ideas or anything y'all want to add to that?
No, just looking forward to meeting
Yeah.
everyone. We
Yeah.
did have two people with their hands up. Reggie was first, I believe.
Okay, yeah, I'm gonna keep talking to you offline, GT. Um, okay. Reggie, go ahead. Sorry. Uh-oh. Are you there, Reggie? Maybe we can go have Donald go first then, and maybe Reggie's having technical difficulties.
Okay. Hi, everybody. I'm Donald, and I came to an event you guys gave in DC. I guess I am, so I don't fit a category of being born with the disease or, finding out at a young age. I had, and I don't know whether I got it through my substance abuse or through a sexual encounter. But I have been knowingly diagnosed because I always felt like I was diagnosed, but I never wanted to actually go find out since 1988. And recently, I got a chip in the mail. I have been drug and alcohol free for 37 years. I say that because if I do something destructive, it all goes down the drain. I go back and forth to the hospital. Um, I didn't worry about a transplant because I knew I wasn't going to live long enough to get a transplant. 2013, I got a kidney transplant. Something that I think is very good is to network with people. I think all states are the same. People on disability get the same entitlements as people who are senior citizens. And you have to deal with, you ever notice that there's some people who just get everything? And you wonder, how do they get it? But I never knew how they got it until I started asking questions. And how did you do it? The minute I meet somebody, I can pick up if you're on my side or if you're going to try to help me. Or I can pick up if you're going to nitpick me down to where I don't qualify. I've lived long enough to be able to retire. I hated to retire the last bout in the hospital. I couldn't do hair no more. But I'm 68 years old. I've been in the industry for 40 years, all during that time positive. And just think of what I would have wasted if I didn't really challenge some of the fears. And now I've got a new fear. I got to live life on life's terms because I don't have a job to go to. And I choose to plug into things like your group and other groups like yours to empower myself. Don't want to take up any time, but I think too much time, but I think this is wonderful. I'm glad to see there are young people. You have educated me about lots of things that I didn't even know. Congratulations on the pregnancy, et cetera, et cetera. And those things were not even heard of when I was coming through. So thank you very much. And I look forward for the next email.
Thank you, Donald. Uh, I I feel like we're like way over time, and so we have to wrap it up. I do want to, I mean, maybe we just do one more? I don't know. Do we have more? How many hands do we have? I can't see. It's
Reggie's
just one.
unmuted now.
Oh, okay. Reggie, we'll just end with you, okay?
Good evening, everyone. Thank you for such a fantastic presentation. My name is Reggie Stroud. I'm a heterosexual Black man. I live in Southwest Virginia. I've met you at the NMAC programs that they had, the one in DC and the one in New Orleans, which was also fantastic. I got a lot out of it. I was a 50 plus cohort. I am actually. I'd like to just elaborate on the fact that, disclosure is a very, very, very personal thing. You have to know when, where, and how to present it because people take your precious, life story or your information and utilize it the wrong way. Meaning they take it and they, just make it a conversation with people that you may not want to be aware of it. But it's also something that can, give you closure, that you have met that their threshold where you can say that, I'm allowing HIV to live with me. And the fact that you're taking control of your life and living it to the fullest. I'm 61 years old, be 62 the first day of next month. And I've lived graciously. Like the gentleman said, I utilized drugs for like 20 years of my life and I got clean. I've been clean 30 some years as well. HIV wasn't even in the equation until I took sick many years later. And I thought I had ducked a bullet, but I found out that I was HIV positive. And of course, that was a devastating blow. But I took that um, diagnosis and I grabbed the baton and I got in the race. What I mean by that is I ran to get all the knowledge I could get so that I could live long and healthy because it was seen as a death sentence. Today I stand here. I'm the co-chair of a program that we have, an organization called the Empowerment Project for Life. And that is a program, excuse me, that instills people with hope. I'm a pillar of information in my community. I'm known in the community in which I live in as an advocate. I don't hide behind my diagnosis. I allow my diagnosis to be revealed so that people could get this information and help me to eradicate stigma and that the generation that's coming behind me don't have to, be affected with this here disease. So I thank you for all the information that you have, presented. And I love you all and may God continue to bless you. And thank you for being in the world.
Thank you for sharing.
Thank you. Thank you. Okay. We gotta wrap it up. Bye guys. Thank you guys for joining us. Have a
Thank
good
you
day.
so much.
Thank you so much. Thank you to our wonderful moderator and our amazing panelists. You all are all powerhouses, and we are so thankful that you shared space with us today. Thank you for sharing your stories.
Thank you for having me.